Well, it's been half a year since the world was alerted to the potential pandemic caused by the spread of COVID-19. Most countries in the world went into pandemic prevention mode. South Africa has been in various levels of lockdown for 105 days now. Scientists are learning more and more about the virus daily. But what's true and what is not? Of course, some of the information that we have coming through simply hasn't been truth. Professor Salim Abdool Karim is the chairperson of the COVID-19 Ministerial Advisory Committee and someone who we've spoken to a lot here on The Pulse, and there are a number of questions that we're going to be putting to him tonight. Professor Salim, good evening and thank you so much for your time on The Pulse.
Very good evening, Cathy, and a very good evening to all the viewers.
Sure. Now, we speak to you at a time where, of course, the research and the data around COVID-19 is changing. The latest is around whether or not this virus is an airborne disease. Where are we with that? Has it now been classified as airborne?
So we've always known that the virus is present in the droplets, and the question was, would it be present in the very small droplets, the ones that float in the air for a long time? And the answer we've always thought was yes, they probably do. But whether those little droplets have enough virus that actually leads to infection, that's been a big question. So it's not that we are not clear or don't know whether the virus is in the droplets. What we don't know is how important is that in terms of contributing to airborne transmission. And I think that's the unanswered question. And we need more evidence, we need more data before we can answer that definitively. In the meantime, our planning is based on that. It's based on 3 modes of transmission, including at this stage, potential aerosol transmission.
Yeah. So some scientists have been explicit in saying that COVID-19 is an airborne disease, and therefore, they're cautioning against small enclosed spaces where it might be easier for the virus to float around in the air, areas that don't have good circulation. So speak to us about how cautious then people need to become, because it shifts the dynamics, especially when we're looking at office environments and the kind of spaces that people have been working in.
Yeah, so I think, in the nature of science, especially in COVID, where the science is, very preliminary and, people take different viewpoints, and it depends on, what your understanding of the problem is and what evidence you want to see. So there will be differences of opinion. That's not a problem. In science, we always have differences of opinions, and we try to find each other in some kind of way. And often it leads to spats about things. Right now, we should go on the basis that we have seen evidence of aerosol spread, and enclosed spaces really should be avoided. And particularly in South Africa, the concern revolves around taxis and the way in which taxis provide an enclosed environment where you've got a large number of people. And so one of the discussions we've had with the taxi industry last weekend is the whole issue of keeping at least 2 windows open, one on each side of the taxi. And the way in which to do that, and one can understand in cold weather that may become an issue, but we do need to ensure that there are at least 2 windows open. Whether window jammers will be required or what steps need to be taken is currently under discussion with the Department of Transport.
All right, Dr. Karim, I wanted to take a look at some of the questions that, of course, our viewers have also been sending in to us as part of the question and answer session. So this one from Shavandre: how long will your body's antibodies protect you from getting reinfected with the coronavirus? I think it takes us back to whether or not somebody can get COVID-19 twice.
Oh, I wish I knew that answer. The whole world doesn't know that answer. So we actually do not know what antibodies are required to protect. We do know that a certain number of patients, especially the more symptomatic ones, produce pretty strong antibodies. We call them neutralizing antibodies. We know that individuals do that. We don't know what level of antibody is required to protect, And we have no idea whether those antibodies that were created will protect against a reinfection, because we need countries that have already had epidemics, like China and so on, to now have a new epidemic, so that we can see whether those people who had it before get infected again. So it's a terrible thing to say, but without that kind of evidence, we actually don't yet know whether they'll be protected. We have some animal studies, but we really need human studies to be able to answer that question. So we don't know. Answer is we don't know.
Of course, there have also been questions around, whether somebody can test twice for COVID-19. I wonder, from a research perspective locally, have you found those cases where somebody does test twice for this virus?
Yeah, so we have seen that a small proportion of patients who get COVID, they will test positive on PCR. In other words, they have the genome of the virus for about 14 days. But in a small proportion of them, they test positive up to 2-3 months. And we're not sure why that is the case. And in fact, I have a few patients of my own that are still testing positive. But very interestingly, their virus is dead. They are not infectious. They have dead virus. We can't find actual live virus in there, even though they're testing positive by PCR. So at this stage, it looks like that the virus continues to shed and is still present in the nose and the back of the throat. But those viruses have been killed by the patient's antibodies, and so they are not viable. And so those individuals, even though they test positive, are not infectious.
All right. Professor Karim, let's take another question that our viewers have put up on social media. Can the Prof tell us ways to strengthen our immune systems in order for our bodies to fight the virus, instead of just wash your hands and wear a mask? I guess it comes back to those concoctions and umsonyani and all sorts of other things come to mind.
Well, Cathy, I'm a very strong philosophy of if you just eat a decent diet with your food groups, you don't need anything else. Please don't believe people that want to try and sell you this kind of medicine or that kind of medicine and tablets, and take lemon juice and honey, and none of that works. It's just those are just old wives' tales. In fact, I'm blaming old wives. Actually, it's just they're just stories and anecdotes. They're not real. Your normal immune system is good enough.
Doctor, don't say that. I've been drowning myself in orange and ginger, so that's definitely not good. That's not the answer I'm looking for. All right, let's take a look at another question that's coming through to us this afternoon. Somebody else on Twitter saying, is there any scientific evidence which suggests that recovered patients from COVID-19 are free from infection? I think he's already answered this question. Let's see if we have another question that we can look at right now. How will someone who tested positive for COVID-19 know they are now negative and it's safe to come out of self-isolation if clinics and pharmacies refuse to test or retest somebody who doesn't display any symptoms? Prof?
Yeah, so we have looked at this issue in a lot of detail. There are now at least 3 or 4 studies which show quite clearly that our current approach is correct, which is that when you want to diagnose somebody as having COVID, you do a test and you do the PCR test and show they have the virus in their throat or their nose. From the date of first onset of symptoms, when they first got, the sore throat or the headache, from that point, you can count 14 days and you are now recovered. If you're still not pyrexic, you don't have a fever and you're fine, at the end of 14 days, you can come out of quarantine, you are no longer infectious, you've now had your COVID and you've recovered. We know that because the evidence now has grown sufficiently for us to be confident. You do not need a negative test in order to come out of quarantine anymore.
All right. Prof, I'm going to go in a slightly different direction now. There's more and more increasing evidence around corruption that is taking place under COVID-19. I wonder, what does this do to the efforts that government is trying to put in place? And for scientists like yourself, who are dedicated to seeing this country win the fight, but every day we're hearing more and more of how taxpayers' money is being squandered, whether for scooter ambulances that are not actual ambulances, or for projects that are claiming, that are said to be COVID-19 projects, but in fact have not been that.
You know, I've seen all over the world, and in particular in South Africa, that there will be certain unscrupulous individuals who use the opportunity to steal. It's really sad, because when they steal, they are really stealing from the poor. This is not the rich people that they're stealing from. And it breaks my heart to see this, really. And when you think so many people are giving selflessly of their time, their effort to do what they can, and somebody else is just trying to make a quick rand and a quick buck out of it, it's sad. I just hope that people have a conscience and they develop shame for what they do. Because I think that's missing in our country all too often. When I read this morning's newspaper and how much of money was stolen from ESCOM in building those new plants, it just, those numbers boggle the mind. 4 billion. How much? I mean, how many houses and how much of water and we could have been providing people? It's sad, really sad, Cathy.
All right.